The acid fast stain is a differential stain, so as you know, that means it's using two different dyes. There is a genus called Mycobacterium that has the regular cell wall, but it has, in addition to the peptidoglycan, it has a lot of waxy components and a very high lipid content to it. And because of that, it does not uptake the gram stain very well. So really, you can't say that Mycobacterium are gram positive or gram negative because they really don't handle that stain well. And it's all due to this high lipid content that they have in their cell wall. So if you can't do the gram stain, you're going to have to be able to stain a different way. And what we do would be an acid fast stain in place of the gram stain. So to do the acid fast stain, because of that lipid content that is so high, it's difficult for stains to penetrate, so you're going to have to do this acid fast stain, but it also requires heat. You're going to have to use heat for the stains to be able to penetrate. From a medical standpoint, what species are we concerned about? Well, Mycobacterium tuberculosis and Mycobacterium leprae, the causative agents of leprosy and also tuberculosis or TB. So to do the acid fast stain, you're going to have to set up an apparatus where you can steam the item. This is kind of similar to the spore stain from that standpoint. So usually we set up a hot plate, we put a beaker on it that has water in it, and then you put something across the top of the beaker that you'll be able to place your slide on. And so you're going to take your slide, smear your bacteria on it, you can heat fix it, and then on top of this apparatus to hold your slide, you're going to place your slide, you get the water boiling, so the steam, or almost boiling, so the steam is coming up to the slide. You take a piece of blotting paper and place that over the slide. I usually try to rip it or cut it to fit about the same size of the slide. So you put that blotting paper over it. This, once again, is very similar to spore stain. However, the primary stain that you use is carbofusion. This is a red stain. You're going to put, so you've got the slide, you're going to put the blotting paper on it, and then you're going to, on that blotting paper, just flood it with the carbofusion, the red dye. You need to leave it on for 5 minutes. The entire time you've got steam coming up from underneath the slide, heating it. You have to watch the slide the entire 5 minutes. Don't walk away. No, you have to stay there and watch it because you do not want the blotting paper to dry out. So every time it starts to look like it's dry, add more carbofusion to keep it moist. So it needs to remain moist that whole 5 minutes. After 5 minutes, carefully, you remove the blotting paper and dispose of it. The slide you're going to rinse. Then you will add acid alcohol for 30 seconds. This is a decolorization step, and then you're going to rinse it. After that, you add methylene blue. This is your counter stain or your secondary stain. Leave that on for 1 minute. Then you will rinse it, blot it like you normally do, and then view it under the microscope. When you look at it under the microscope, the acid fast bacteria will appear red, and the non-acid fast bacteria will appear blue. So it's easy to interpret it. It's just a little bit time consuming because you have to deal with the heat and all of that. And it all goes back to that lipid layer. So if you suspect that you have Mycobacterium, if you attempt a gram stain, it's probably not going to turn out well. So in addition, you'll need to do an acid fast stain.